Welcome to Roundtable 1 from the International Symposium on Performance Science. My name is Williamon. I'm head of the Center for Performance Science at the Royal College of Music, and it's a great pleasure to be able to welcome you to our discussion on applying performance science in music education, our current settings, policies, and practices fostering well-being. I've worked at the Royal College of Music since 2000, and the RCM is a conservatoire where a lot of practical music making happens. And I work in a center for performance science. And so there's a constant tussle between what I may want to do as a researcher, what I feel passionate about and trying to understand, and what is happening on the day-to-day ebb and flow of our students at the college. And it's a real privilege actually to be able to work at that interface where research and practice come together. One of the ways in which I describe the center is that we are distinctive in that we have a mission really to do research that is applied and that has a direct impact on the curriculum, on the practices, on the performance of our students and our staff. It's really intellectually stimulating to be able to work in that space, and it's a great opportunity, I think, both to have some say in terms of advancing music education, but also with the interplay, having a great deal of feedback into how we can advance the science of performance. But I'm here to learn this evening, and evening for me anyway, and I have the great pleasure of having been able to assemble a distinguished panel of colleagues who also have been working at this interface of research, teaching, clinical practice. And so the next hour, we'll use this time to explore some of the themes that we've been working on. So that's enough about me. I'll ask my colleagues to introduce themselves. I'll stop sharing my screen, and we'll let the discussion begin. So if I could ask Margaret, if you could start by giving just a brief introduction to yourself.
Okay, thank you, Aaron, and thank you for the invitation to be part of this panel. Before I begin and tell my story, briefly, I'd like to acknowledge the traditional owners of the lands on which I'm speaking today, the Wurundjeri people of the Kulin Nation, who've shared their own stories in teaching and learning for thousands of years, and pay my respects to their elders, past, present, and emerging. So I'm here from Melbourne, Australia. Good evening, good morning, wherever you are. So performance health and wellbeing has defined my career due to my own experiences as an adolescent with music performance anxiety, playing clarinet and attempting classical voice with a young adolescent voice, nonetheless. And it wasn't addressed or talked about when I was training, 30 odd years ago. And the anxiety, the stage fright caused me to avoid playing music completely. And thus, along with that, the immense satisfaction and reward from, playing music and performing for others and with others. So back in my then mid-20s, I took up classical singing training again and was doing my honors research in psychology, and those feelings started to emerge again, the anxious feelings, just as I was needing to do some research. And my teacher at the time was bass baritone with Opera Australia and was also starting his PhD in performance anxiety in opera singers. And so I started doing some research for him and started investigating music performance anxiety as a subtype of social phobia. So fast forward to that, completed a PhD in music performance anxiety and commenced a career in clinical psychology, starting my own practice, specializing with performing artists and also working in occupational rehabilitation generally. I commenced a postdoc in 2010, my first one with Professor Gary McPherson at the Melbourne Conservatorium of Music, investigating how we could create and maintain the motivation and opportunity for young people to learn and engage with music. And then a subsequent research postdoc with Paul Evans and Peter Mitschke and Gary on optimizing musical performance. So within my time, so since being at the University of Melbourne since 2010, I've had the fortune of developing a number of subjects, new subjects in performance science. So an undergraduate second year subject, performance psychology, essentially, peak performance under pressure, in the BMA Bachelor of Music program. And that was developed with the head of brass and performance at the time, lower brass. And that was important because that established buy-in with the musicians, but also with the two of us as a musician and a psychologist working together was really vital, I think, in its carryover and its influence. And another senior member of the faculty in brass then saw that, and as they were developing their new Masters of Orchestral Performance degree, decided that, or mandated that, musicians' health and psychological strategies and mental skills would be core subjects in the first year of that master's course. And that's how I've gotten to be essentially where I am and conducting research along the way. So it's an interplay between a personal story and a professional one.
Margaret, thank you very much. Also, just to say that should anyone have questions for any of the panelists or general questions that you want to put, please put them in the chat and we will integrate them into the discussion. So if I could go next to Gilles, please.
Bonsoir, good evening. It's a pleasure to be here with all of you, and thank you for the invitation to be part of this roundtable. Since we are going to talk about science of performance, I think I can truly say that that has been defining my career since the very beginning. More than 20 years ago, I was invited to set up a research lab in piano pedagogy, and there were lots of money that were made available. And it became quite a big infrastructure that have looked at the aspect of teaching and the aspect of learning music, of course. And at the heart of that research lab, there was really interdisciplinary research in order to be able to conduct research that would really look at the science and how that could be involved in the process of teaching and learning music. It was important for me right from the start to connect with researchers from about every single faculty of my university. Some have been around for more than 20 years, applying their specialty from their own disciplines to music learning and music teaching. So there have been a lot of exchange and a lots of collaboration. And I think I can say that in all the research projects that have been developed in my lab, each one had at least 2 or 3 disciplines that were involved, and they were really done in collaboration with researchers from other disciplines. About 10 years ago, it became obvious in the work we were doing in the lab that musicians' wellness was a big factor for people involved with music learning and music performing. And we then started to do quite a bit of research in that area. We've opened in my music school a clinical project, the Musicians' Wellness Center, where we offer workshops, education, credited courses, put also musician in touch with a clinician in the Ottawa region. And then we connected a few years ago the different universities across Canada and created the Canadian Network for Musicians' Health and Wellness. And I'll have a chance to talk to you a little bit about that today. And more recently, we have established at the University of Ottawa a research institute in music and health, which is expanding that to a much more broader context where we looked at the aspects of music, but its benefit on various conditions, various aspects of physical health, mental health, sensory health, cognitive health. So we've looked at that aspect as well. So that has been my various outreach that I've had over the years, where it has involved the science in some aspects of music and music performance and music making.
Gilles, thank you very much. It's a very impressive setup and track record. So at this point, could I go to John? Could you please just introduce yourself?
Thanks, Aaron, and thank you for the invite. I'll just allow me to share my screen. There we go. Everybody see that okay? Hope so. Okay, so who am I? A jack of all trades, many trades anyway. Medicine, engineering, epidemiology, clinical epidemiology, psychotherapy, and my first and really only love is the piano. I'm associated with McMaster Medical School and University of Toronto Music and Health Research Collaboratory. How come my slides aren't advancing here? There we go. The history of the clinic, the musicians clinic, goes back to 1986, when the Organization of Canadian Symphony Musicians asked me to start a clinic, where it was met with some consternation, mostly good humor in retrospect. And we're still bumbling along in the Canadian healthcare system, which has been off and on under threat, but still running. I think Quebec still hasn't joined the Canada Health Act yet, but hopefully someday. So there's my acronym, MADNESS. We still stick with that. And we see lots of musicians referred for many different madness problems. Overarching is the organization PAMA. Many of you have are members. So good to see you all, miss you. Honoring Alice Brown from Brenner way back when. It's a multidisciplinary group from around the world. It's growing. It's still a small family of about 400 and has some growing pains in various quarters, but overall, very exciting and dynamic group to be involved with internationally. The core conceptualization I've been working on is awareness of performance stress. Notwithstanding my own story as a pianist, getting injured very early on, and trying to understand from an evidence-based perspective what on earth is going on. So in a nutshell, these are the key concepts we work on, whether clinically, educationally, still looking at many research questions. And here's the toolkit we currently have, Surface EMG and all this stuff, which I'll give you a quick demo in a short video. My dream was actually to develop something portable. So all the years as a frustrated electronic music composer, very unemployed, came in very handy. All my years in Ottawa at the National Research Council to design something with the help of very innovative engineers to get a portable unit, which I can drag to around the world, as well as to various conservatories. Here's a quick clip that hit the...
There's a big event happening tonight at the McGill Theatre at the University of Toronto called The Sounds of Science. It's bringing together medicine, music, and technology. And of course, Daily Planet has a backstage pass to the tech rehearsal. So Dr. Chong, what's the system that you're bringing to the Sounds of Science?
Well, this is a setup that will measure muscle activity, motion activity during the act of playing a musical instrument. In this case, someone that's playing violin. So this is the left trapezius or left shoulder. This is the right trapezius or right shoulder. The left forearm, the blue guy, and the right forearm is the green guy.
Now, what's the purpose of the system?
Well, you can now correlate muscle activation and movement together along with audio and video signals. So we can quantitatively analyze motor control.
So that's what this is for, actually, is looking at musical related injuries. Is that something that's pretty common?
The latest studies from Australia orchestral musicians say that there's an 84% lifetime prevalence of injury.
What?
And 50% are playing hurt at any given time.
Sounds like it's some dirty little secret out there.
Absolutely, because we don't ask, don't tell. So we've kept these injuries a secret for a long time. This part of the performance stress that musicians, especially at the professional level, have to there. Just once somebody knows you're hurt, you might not get the call.
Wow, so it sounds like this system is something that the industry absolutely needs.
Absolutely.
So show me how it works.
Well, Linnea can start playing. We can...
Oh, wow, so you're getting live feedback from the sensors as she's playing right there.
Time. So one of the big applications, other than quantitatively analyzing, is the biofeedback application. So if we say there's an excessive muscle activity in the right shoulder because of possibly a rotator cuff injury, and we can start downtraining the amount of muscle improvement. Commonly in the violin, you'll see somebody crunching. Can you crunch? Suzuki style. There you go. And so you can see the
oh, holy cow! Look at that spike.
Well, that's not good for the neck and the spinal cord. So we see very commonly lots of, especially in the older musicians, pros, lots of wear and tear in the cervical spine, neck, and sometimes requiring surgery.
And so could your system actually help musicians avoid?
That's right. We pick up stuff early before it becomes a problem, before they have pain or numbness or loss of control. Sometimes it's just simply playing too long. So if we can just reduce a little bit of force, say, on the left shoulder in the violinist, you can save a big problem down the line.
Wow, a system that actually helps musicians have a long and healthy career. Dr. Chong, that's music to my ears.
It's music to my ears too. Linnea, can you play us out?
Okay, enough unabashed promotion anyway. So in the clinic, we packaged this into a 12-tone tune-up target system, just in honor of my unemployed composer status. You can see all these target topics, if in an educational situation or in a clinical situation, patients allowed to move through these sessions. It's an adaptation of the prolonged exposure Edna-Fola program for performance traumatic stress disorder is the primary clinical target. Here's Garrick Olson, and he's my control group of one. Absolutely quiet muscles, meditates every day, amazing yoga, and him playing the Chopin Ballade No. 1, the octave passage. See how nice and clean those signals are. Other work we're working on is we're in Canada, so cannabis is medically been around for 20 years and 3 years completely legalized, and it has, especially CBD, has a lot of therapeutic potential for pain intensity and interference reduction, as well as some mental health application. So the challenge to the panel from me is it time for trauma-informed music education? So it's a bit of a takeoff on trauma-informed care. So I'll throw that out to the panel to think about it. And that's it.
John, thank you very much. That's a great challenge. We'll come back around to that in just a moment. I love madness, your A to G, and also the picture of you with the cannabis as well. So thank you for all of that. Let me go to Isabelle Cossette. Isabelle, if you could just introduce yourself briefly, and then I'll move into some specific questions I've prepared, and then we'll open up the discussion and we'll take up John's challenge.
Well, thank you very much. I mean, it's a bit intimidating, I must say, to follow you three. So I will try to be short and sweet. I've come to, for me, I did not know it was called performance science when I was doing it, but I have always been kind of having this mindset of trying to understand what I was doing while I was trained as a performer. And that led me to ask questions to many people and work with physicians, engineers, in biomechanics, or mostly in respiratory physiology. And that led me also to start a lab here at McGill University, the Music, Performance and Body Lab, and then being the director of CERMIT as well, the Center for Interdisciplinary Research in Music and Media Technology. now I'm kind of going back to the students and where I was at that time when I was asking those questions. And the students I supervise mostly come to me with questions about, okay, how do we perform? How do we sustain a career as a performer in a healthy way? So I'm always around those kind of topics. And I must say that I'm very encouraged to see that things have very much evolved over the last 20 years when I came after, wanting to do, research, very, how would you say that? Kind of fundamental research on performance. And coming in the music faculty, I did not have necessarily the right approach to say, let's do the kind of work that John and Margaret and Gilles are doing. It was not necessarily the right moment. Now, I think it's the right moment. Students are really asking for that. And I'm very pleased to be part of this discussion with you all. And the conference is a good start to start this discussion. So I'll stop here.
Well, thank you, Isabelle. Can I start with you, Isabelle, by asking you, in terms of looking across the field of performance science generally, could you say a little bit about the areas in which you feel that the field has already made significant contributions to music practice? And what are the areas that you see the most potential or the promise?
So I think that basically the first step is that we're talking about. 20 years ago, I mean, even in the courses I was giving, it was, students were very, let's say, timid, and it was not easy to talk about all those things about injuries, about mental health issues. I mean, students are ready, they ask for that. And then between colleagues, it's not necessarily exactly yet as open, but it's progressing. We're all here talking about that. It's fantastic, and sharing ideas how we can kind of all work together and have a way to help our future musicians, or training our students so they can sustain a career in a healthy way. So this is a big change, but I think there is still quite a lot of work to do in changing the culture. Even we still have to think about, how to have a balance between all the demands that we're asking them to do, and, like in terms of practicing more in a deliberate way, the equilibrium in their life and everything. So this is kind of also for us, having a conference 12 hours a day on Zoom. I think we still have a few things to learn ourselves, but so I don't know if that kind of answers the question. I think it would be fantastic if we would have like multidisciplinary team around the performer, the training performers, so we can kind of, I think it's the word is chim in to bring our perspective, be it like some of our keynote speakers, they come with different perspective, and then the educator, the biomechanical person, the mental person. I mean, it would be fantastic to have this kind of team around the performer, like they a bit have in sports. I don't know if that answers your question, or
so
science. Sorry.
Many ways in which we can chime in. Just to say that I think the potential for impact in terms of learning and teaching is great. In terms of understanding and advancing creative practice is great. And also, as is the focus of this conference, in terms of supporting health and well-being. You touched on the demands that we see within the profession on students' time, on colleagues' time. And I wonder, Gilles, if I could come to you and ask you to say a little bit about what you feel is the appetite for people within the sector, for those performers, those students, as teachers, to engage with applied performance science?
Well, I can certainly follow on Isabelle saying that things like what we're discussing tonight were almost unheard of 20 years ago, at least on university campus. And things have changed a lot. And I thought I would take this opportunity to look at the appetite and the scope of things by reporting on the Canadian context and reporting on a survey that has just been completed. So I will take a minute to share my screen. So as I mentioned before, I'm working closely with the Canadian Network for Musicians' Health and Wellness that was created a couple of years ago between a group of colleagues that were interested into musical health and were belonging to different universities across the country. And over time, many other researchers and professors joined the network, and we're covering a number of universities now. And one of the first things that we decided to do was to try to understand what kind of resources were available in Canadian post-secondary music institution regarding health and wellness. You can see here what is the context of the musical health and wellness network, certainly to increase knowledge and understanding, to advocate for healthy and ethical practices, evidence-informed resources, sharing of knowledge and research, and interdisciplinary network. So the first task that was just finished recently was that online survey that was conducted throughout Canada, trying to understand what resources were available to our students and what form would those resources take. The project was led by Caroline Traube, who is at the music faculty at the Université de Montréal. And then the analysis was prepared by Caroline, as well as Anna Zumbenzin, who is at the Faculty of Health Sciences and Rehabilitation at the University of Ottawa. So basically, it was a survey that people would receive. It was explaining what it was about, explaining what we were trying to do. And then this is the kind of results we got. So the survey was sent to 17 institutions, mainly universities and conservatories. We got responses from 13 universities, going over 6 provinces in Canada. We also got a reply from the network of music conservatories in Quebec. So there are 7 conservatories in Quebec that are run provincially, but the network of the whole conservatory decided to take part. So that's what we're going to report. And the Cégep de Sainte-Foy in Quebec. To give you an idea what that represents, so this is the country. In yellow, you have all the cities where we got a reply from the universities that were there, so you can see where it belongs. And we also got a few where it didn't get any response. And then when we looked at the results, it was quite interesting, and it gives us a very good understanding of how things have certainly evolved over the last 20 years. So out of everyone that responded, 14 post-secondary institutions were offering resources, and only 1 had no specific resources for their music students. And you do get the breakdown underneath. So quite a number of them are credited courses that students can take. It is included into their program, and they get credits for doing those courses. In other instances, it's non-credit courses for the pale blue, where they can attend some activities, but they will not get credits for completing those. There's a number of workshops. Many institutions are running workshops, and there were all kinds of small other things that were run in various universities. When we analyze how often those happen, it is fairly often. Many universities have constant courses being offered, courses every semester, or recurring workshops that are offered, sometimes more than 1 or 2 courses a year. So in many institutions, those courses are now part of the usual delivery of what's available. We were interested to know what topics was being covered, and you can see here the physical health being quite important. Mental health has increased quite a bit. It took more time for that to increase over the years, but certainly now it has been catching up. Introducing some methods for wellness and good health is also something often mentioned. And there were information on health and wellness issues, so specific issues that were looked at, and other that could be workshops on hearing loss or various approach like that. We did look at what were the approach that were most often offered either within a course, if there was some specific methods or approach being used, or throughout workshops. And this is the guidelines of what you have. So yoga seems to be a big one. Yoga for musicians, many courses have been developing with specialization for musicians, and many institutions are offering that services to their students, sometimes even with credits. The Alexander technique has also made itself available in many institutions, and other ones like Feldenkrais method, body mapping, Gerda-Alexander eutonie, and probably a word to be said here. We were fortunate in the province of Quebec to have someone representing Gerda-Alexander eutonie, and for a while it was a course in a university. You could get a graduate program and become a practitioner in that approach. So while it is not as known as the other above, it is having a big impact, not so much outside of the province of Quebec, but certainly in Quebec. Some audiology workshops about hearing loss, Tai Chi, mindfulness, and one specific voice training. And I would end that presentation by one of the questions we have was how much collaboration is now being established between music school, musicians, researchers, performers, and other fields outside of music schools, and to what extent are graduate students being able to get involved with other disciplines. And we found that there are more and more of that science participation with music. And you can see all the different disciplines: kinesiology, human kinetic, physiotherapy, physical education, vocal health, health sciences, neurobiology, psychology, audiology, education, and in engineering. In many programs, students, graduate students, are able to take courses in those disciplines while being in music, or our music students are admitted into those programs to do a PhD or sometimes a master. So there's a lot of combination now in many of the institutes that we have reviewed where that partnership is possible. And we see more and more experts from other disciplines on juries of music students that are doing a master or a PhD, but looking at an area that involves science and music, just as we see more and more musicians being asked to be on juries in human kinetics or in health sciences, because the students are doing research in those disciplines, but looking specifically at musicians and what is happening there. So in conclusion, almost all institutions offer health and wellness resources and training. There appear to be quite a variety of activities being offered. Now, the question is always, what is the level of awareness and interest among music students and teachers? And certainly it might not be something that is supported by a majority. It might be a limited number of students who participate, but the resources are there. The institutions are making them available. So we see a big change over the years. What we are not reporting in our presentation, and I think that this is another aspect that will be important for our network to explore, is how much of the knowledge we have from science, from somatic approaches, from health approaches, how much of that is actually included into private lessons. And there's probably more and more professors in universities and conservatories who are aware of that and where it is being integrated into their own individual lesson with their students. And we don't have a picture of how much of that is now available and now working. So it gives you a basic outline of what we see in the country, and certainly goes in line with Isabelle first thought that things have changed immensely, and that we have over the years seen that it was time, and that they were students were more aware of it, were more asking about it, and were more developing it. Now, on another note, I have to say that recently I was looking at a questionnaire that some students had done because they wanted to see what kind of workshops should be asked, and they wanted to know from the students what they would like to have. And one of the questions was, do you have some pain-related problems, and do you have some performance anxiety? And a number of them, not surprisingly, said yes. There was another question that was a little bit more troublesome when asked if they had discussed the pain that they were experiencing or the mental anxiety they could be experiencing. 80 and 84% says that they had never discussed that with their individual teacher or their private teacher. They discuss it with us who run the Musical Wellness Center. They discuss this among their friends. They go and see health practitioners, which was not necessarily the case many years ago. Today, many of them have their physiotherapists, and they have their doctors, or they have different resources they go to, but it is not something that is necessarily as open as we would always like. So here's a quick shot of how the situation seems to be in our Canadian institutions.
Thank you very much. I wonder if I could build on that and turn to John and say, well, John, you're working very often, sometimes on the other side of this. I mean, we see a developmental pattern where institutions are starting to move in a direction to be more proactive in terms of supporting health. We see a desire from students and other performers to get advice, to get support, to be healthier. And I wonder from your perspective, in terms of working with musicians who have health issues, what can the people who are working in music education do to make your work easier?
Yeah, thanks, Aaron. That's a multi-pronged question. I'll go back like Margaret did. I got hurt at what we now know as the Glenn Gould School. There was nothing there in the 60s. I started working with the National Youth Orchestra of Canada in 1988 for a few years, whereupon the team was thrown out after discovering a sexual abuse case and that administration took 10 years to, actually the organization took 10 years to recover. And then our team is back. And so that was phase 2 in general workshops, much like Gilles said. And now we're in phase 3 with an integrated mental health program. As far as the Glenn Gould School goes, back in 2009, Jim and Agneson, my golf buddy, the dean, I call him Jimmy Dean, invited me to get the performance awareness course going. I said, sure, yeah, great, fun. So I had that Ape Lab set up, and it was fun in a small group because we could basically wire each other up and make fun of each other, much like in a hockey dressing room, just to go back to Meg's keynote talk. You know, it was very, very interactive and exciting. Based on that, Jim made it mandatory for all undergraduates and postgraduates, whereupon you can feel the denominator growing and some resistance growing, and maybe Marg and Gilles can talk about that. It was heavy sledding because everybody was forced to do it. It was mandatory and was graded by me. So there was a slight conflict of interest where I just went there and had fun with the Ape Labs and all my monkey jokes and stuff. And I do have quite a bit of baseline data and follow-up data over 6 years, which we still have to crunch. But yeah, it's not for everybody. So those are just sort of words of experience, let's put it that way. Now, wearing my PAMA hat, we've got lots of collaborations going. How could we make it easier? I figured, well, I better go big than go small. So over the last 10 years, I've been dragging the Ape Lab around the world and nobody's assassinated me. There's a couple of border guards were very concerned about the sensors flashing when I forgot to turn them off. And we have some very exciting collaborations going. First of all, with NASM, National Association of Schools of Music. Thank you, Aaron, for contributing, and the whole team, and with PAMA, and College Music Society is going very strong, and a lot of movers and shakers in that organization, and Music Teachers National Association. So that's where the policies can change from the top down. Bottom up, well, it's the patients that I see day to day and grind through all their problems. And as they get better, amazingly, and how resilient they are, they become the ambassadors. So I've been always an advocate of worker education and advocacy. So whether it be organized through unions or whether organized just through their friends and drinking buddies, that's the way the culture has changed over the last 20 years. So many of the faculty that I've looked after are the ambassadors and preachers that affect their students and affects their pedagogy, because once they went through their agony of their injuries and mental health crises, they can speak with authenticity about the agony and pain and threats and survival threats they've been through. So that's my sort of philosophy. This very barefoot doctor approach. And also, there's some administrative stuff, but I'm not good in dealing with bureaucracy and committees and stuff. I just save that for a couple of days a month with Pam, and that's about all I can handle. So those are my general thoughts. Overall, I think there's tremendous room for collaboration, excitement, as Gilles has said, just not only in Canada, but across the world. You heard Eckhart's group yesterday, just tremendous amount of research that's applied throughout, all through the European community, and of course, right around the world through PAMA, through Bronwyn, and many of our colleagues. So it's an exciting time. It's a tipping point, I think, and I think we're doing way better than the Leafs are doing this season. So I'll end my comment there.
On that controversial note, thank you very much. Look, I see that there are a number of questions building up in the chat. And before I go to those, I just wanted to turn to Margaret at this point and ask you, Margaret, if you could say a little bit about your work that extends beyond music and the extent to which we might be able to look across to other fields to gain some insight, to have a proper exchange of knowledge where we contribute to what they do and they also contribute back to what we do.
Yes, thank you, Aaron. I mean, the point of interdisciplinarity has been discussed by all panelists to this point, and it's rife and it's improving and increasing, which is to the benefit of us all. I've done work and research drawing from wellbeing theory, performing arts medicine, performance science, education, health promotion, behavior change, safety science, sports psychology, occupational and public health. So we can draw from all those areas. We also need to, there's a project in Melbourne that commenced a few years ago called the Arts Wellbeing Collective through the Arts Centre Melbourne. And that focus is really engaging with industry. So that's an important thing that we can do within the performing arts to promote positive mental health and consult using with those industry partners, using design thinking principles to structure, create human-centered, problem statements and solutions. And the key points from this work is to map, with stakeholders at every level, map the pathways to risk factors, gather data, plan, implement, and constantly evaluate. And that communication and liaison and collection and collaboration is important and essential. If we look, so thinking within the arts, I'm thinking of dance again. So psychosocial stress, for example, adversely affects the capacity of dancers and leads to higher injury rates. So liaising with that field and that discipline is a bit of a no-brainer there. And externally, interestingly enough, it's vital that we look to research into behaviour change programs, for example, for effective practices for clinical medicine and public health change. And if I share, I've got a chance to share my screen for a moment. So let me do that and just look, because it speaks to the complexity of the issues. So for example, we've got Mitchie's, behaviour change wheel, the COMBI being capability, opportunity and motivation. And so we've got, individual sources of behaviour, physical, social, psychological, but then around that, we need to look at education, we need to look at training, enablement, the environment, how could it be structured? And then the policy around that as well. What are the guidelines? What's the service provision, the planning, the communication, the marketing, and so on. So that is just one example of, the complexity of what we need to do, but also the knowledge is out there and we can draw from it. And I do point people to Mitchie's work. I'm also going to flash forward now, to, excuse me, I didn't get all these ready, but here we go. So obviously also elite sports is a no-brainer, and we had Meg talk about that in the opening keynote. So many synergies in that work. And for example, this is a framework that's developed by colleagues that I've started working with from the University of Melbourne, the Elite Sports Centre with the Centre for Youth Mental Health. And, as athletes do, we can, and what we've tried to do with our Scholarship of Teaching and Learning is build foundational components and identify risk early, and then move to provide more specialist care along the way that involves an awareness and a receptivity from faculty, which is very important. And also, finally, I think some of the work that I'm doing now with colleagues that we've presented on earlier is virtual reality and artificial intelligence. What are the affordances there? So using, drawing from expertise in computing and information systems in teaching and learning, how can that help performers and audience members experience a performance, teach performance skills, and what are the ethical implications of that work? The data capture, for example, what headsets and wearables do you use, who owns that data, the apps, and so on. So these are issues that are currently very important to address. Yeah.
Thank you very much. And can I just say that on yesterday's program, there was a symposium that you gave on some of that work on VR, which I recommend. So the recording is available at the moment. Thank you very much. There's a question here I'll put to all of you, whoever wishes to come in. Do you have suggestions on how people working in performance science in an academic environment can balance their activities between research and applied performance? That sounds like a great question for you, Isabelle. Perhaps you could come in on that.
Sorry, can you repeat it? Because I was looking at the chat and it was sent to you only, I guess?
That's right, yes.
Okay, sorry.
Do you have suggestions on how people working in performance science in an academic environment can balance their activities between research and applied performance?
Well, this is one of the challenges that we are facing a little bit in academia, where often people will be evaluated on teaching service and research or performance often. And if we want to have someone working at the interface of research and practice, it is a bit challenging to find the right kind of format in academia. But I think it is, in fact, necessary to maybe change a little bit our approach, because we need some people working and filling in that gap between research and practice more, because I mean practitioners, they have so many questions and needs, and students as well, and researchers, they have other needs and questions, and so I mean there is someone in between that has to work. How to balance it, I don't have the answer. It's kind of funny because I used to be a performer. I was trained as a performer, and now I'm considered a researcher. It seems that I cannot be one or the other, or like I cannot be both at the same time. There's a kind of resistance to that, but I think we need it. So the balance is I guess you do your best and you prioritize the most important things. I'm not sure exactly how I can answer that question, but academia it's a bit difficult. I think that in the health area, it's more recognized, or yeah, I think that all in clinical work and everything, but we don't have that much here in our institution in Canada, I think, yet in music, that's what I mean. I don't know if it answers really the question. I can say that we're looking for someone, in fact, because we are creating a more applied performance science initiative, and we have, in fact, posted a position which would play the role of, filling in that gap. So if anyone is interested, just email me, or I can post it there. Or
yeah, actually, that's really exciting, Isabelle. Could you post a link to that job advert in the chat?
Okay.
There's another question here, which I'd like to put to Gilles, if I may, which is everyone can see in the chat. It says, I would be interested in hearing the panelists' opinions about the extent to which their initiatives to improve performance health education result in meaningful change in student behaviors, and also to what extent there is buy-in or collaboration with performance teachers. Gilles, do you want to come in on that?
Yes, I would say that I will take on something that John said a little while ago about it's not for everybody. And I think that is true. Sometimes we forget that not everyone is interested in well-being. People are looking for different things and different approach. And that is true in sport just as well as in music. 12 years ago, I got a little sprain injuries and I was going to do physiotherapy on campus, and all around me were students that were part of sports team. And I got to chat with them quite a bit over a month. And all of them were coming 2 or 3 times a day for physiotherapy, one for a treatment in the morning, one for being cold and being freeze and being bandaged. And then they would go and play their games and then come back in the evening because of inflammation. And they didn't want to well-being, or didn't looking to necessarily feel good. They were looking to reach a level where it would be manageable for them to continue to work. So we have some of our students that are looking for that. They basically want to be able to get some improvement or get a guarantee that they can keep doing what they do, but they're not necessarily ready to invest everything that is needed to really reach a level of more comfort. And I think we have that among our professors as well. We have some that are much more open about those activities, and others that are much more focused about training a performer and training a professional, and they go that route. So we cannot expect that everybody will be open and happy with what we have to bring and what kind of education and what kind of resources we have. And it depends at what stage of your life you are, and it depends of the type of maturity, and it depends of what you're really looking for at that time. So I think that a lot of what we bring is having a huge impact on many students and on some teachers that are certainly very much excited about that. And for others, it just doesn't seem at that point to be something in which they want to invest in. And it could come later on. When I was initiated to the Alexander technique at 19 years old, I was not that excited about it. And at 30, I thought, oh, this is interesting. And at 45, I said, wow, this is really good. It started to make a lot of sense. So things change. So I think we have to evaluate that whatever we do now is in some way putting seeds that will eventually have some impact. Now, to what extent are professors involved in it? Well, I can only relate an experience I had with John when he came to a music school and did a presentation and a master class to students, and the students got on stage, and the first question was, where is the teacher of the student? If I'm going to work with the students, where's the teacher? The teacher is nowhere to be found. Is there any other performer teacher in the room? There was none. I was the only one he saw, and he was not looking for me. He was looking for other professors that were in performance. So we also face things like that, where students are invited to be part of master classes, but then professors will pull apart. And it's just the reality of where it is now, I think.
Thank you for that. And I think what's really important is that whether people take a direct, focused interest in aspects or certain aspects of health and well-being, at least the topic is now on the table for discussion, and quite firmly so. I want to follow up on one of your points, put one of the questions from the chat to John, if I may. And I think I know the answer, but it says, do you think it would be beneficial to work globally toward a more team teaching approach in music institutions? How might that look?
How would it look? I can tell you specifically the performance awareness class at the Glenn Gould School is still mandatory. So the coordinator, Dave Pell, trombonist, brings in folks, resources, and then questions are asked, and as Gilles nicely said, plants the seed. From my long 6 years doing it, many of those students actually have been patients. So there's a lot of the feedback said, I wish I actually paid attention to the course. Now that I've gotten hurt, now I see I can apply some of the stuff, so I have to go back. The same thing happened at the National Youth Orchestra way back in phase 2. We were competing with exercise like Frisbee, and they had an option to play Frisbee or come to our sessions. And it was about a 50-50 split, because it was quite warm in Kingston, and it was summertime and kids would be kids. So again, it's you can't force anybody to do this stuff. It's an ongoing debate between Jimmy Dean and myself as we shank a ball into the bush and talk about these things. And of course, as Gilles appropriately said, I think Tunis actually showed up, Gilles, to that. Andrew is a great guy, but yeah, again, that's the same at GGS as well. I think the culture at U of T is changing because of Music and Health Collaboratory has been there, and the pressure from the dean, who's just retired. So I think it's a multitude of politics, top down, bottom up, groundswell. The more publicity that comes out, more disclosures. Don't ask, don't tell. And, especially in pop music, people are coming out of the woodwork. In classical music, Lara St. John, shout out to Lara, coming out about the issues, picking up issues at Juilliard, and of course the press at U of T. This makes the issue flash with shining lights, or it actually smells like my office right now, because a skunk let off a bomb, I think, outside this afternoon. So depends whatever your taste and whatever is happening, but it's usually toxic. So that's why I was challenging folks about trauma-informed medical education. We got a long way to go in healthcare, But what I see from day to day is trauma, trauma, and more trauma. Sometimes it's performance related. Sometimes it's early childhood development. But most of the time, as Eckhart said and Anna said, it's something to do with the teacher and the student. Something bad happened. And just horrific cases of instruments being taken away, funding taken away if you didn't make it through the first round. It's just very traumatic. And some of the techniques I've learned in my psychotherapy training just brings it. It's really difficult work, as all trauma work is. But when it comes so close to the attachment, as we mentioned in the discussion today, the attachment of the athlete, the attachment of the artist to themselves, it is shattering to that person. So a lot of this stuff actually happens in the Faculty of Music. It happens at the conservatories, as you know, Aaron, very much. And that's why I would throw out the challenge just to start thinking about trauma-informed medical as well as musical education. So help providers and patients who are generally young students can nip it in the bud and down train some of the chronic stress health effects that unfortunately I see day to day, which are quite tough.
Yeah, that's a great challenge. I'm aware of the time, and I wonder if I could just put the very last question to Margaret, also from the audience, which says, what changes or developments do you hope to see in this field for the next generation of aspiring researchers?
Oh, more. Yeah, can I just say more of everything that we've just discussed, more opportunity. I think we need to acknowledge the importance of putting this into the curriculum. I say this knowing that it's very full, and knowing that John's just talked about, we can't shove it down people's throats, but we do need to be able to communicate and offer students basic knowledge and understanding and practice from the ground level up. In their training. It's what they're asking for. They need to see buy-in from all levels of faculty, all levels of organization. I think if we can open up a conversation in a respectful way, that is a good way forward.
Margaret, thank you very much. And indeed, thanks to everybody who took part today. Thank you for your questions. It's 1:30 a.m. here in London and my voice is completely gone, so I appreciate your patience for that. We have a very full program tomorrow. I look forward to seeing you all there, and it just remains for me to say thank you again, and we'll see you tomorrow.